Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale of Two Hygienists in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi, everyone. Tom Viola here with yet another Fast Facts Pharmacology Edition. Well, this edition, and several of the next ones coming up, will be all about cardiovascular disease. Why do I care about cardiovascular disease? Well, we should, considering it is the number one cause of death, or at least close to the number one cause of death every year in the United States and abroad. But tell me, Tom, why does that matter to me? Well, every time you treat a patient with cardiovascular disease, you're really dealing with four conundrums, or decisions that are often difficult to make. Conundrums? Yeah. For example, the first conundrum that comes to mind is what? With dental treatment, we have to weigh the benefits of that treatment against the risk of medical complications. Patients with cardiovascular disease are at higher risk for medical complications due to the nature of their disease and the medications used to treat the disease. However, patients with periodontal disease, let's say, are at higher risk for thromboembolic events because we all know that periodontal disease is linked to systemic inflammation, and systemic inflammation is linked to things like atherosclerosis and the formation of clots. So treat the patient and see medical complications. Don't treat the patient and see medical complications. Exactly. What would be another conundrum? Well, how about the fact that with dental treatment, we have to weigh the potential stress induced by that treatment against the patient's ability to withstand stress. Well, wait a minute. Patients with cardiovascular disease have reduced functional reserve, and so they're less able to respond to stressful situations like dental treatment. Exactly. Okay, well, the next conundrum that comes to mind is we're going to use anesthesia, right? I mean, we want to make sure that they're pain-free, but now we have to weigh the benefits of using epinephrine against the associated cardiovascular risk. So we say in patients with cardiovascular disease, we weigh the adverse effects of an absorbed dose of epinephrine against the adverse effects of elevated local anesthetic blood levels. Remember, epinephrine may cause cardiovascular risk, okay? The fact that it can cause tachycardia and an additional stress on the myocardial. But at the same time, not using epinephrine means that the anesthetic leaves the injection site more quickly and can have effects on other organ systems, specifically the brain and the heart. So, use epinephrine or not use epinephrine, there's risk involved in both cases. And finally, with the use of anti-thromboembolic agents, we have to weigh the benefits of the continuation of therapy, meaning they continue to take the medication, against the associated risk of bleeding. So in patients with thromboembolic disorders, we weigh the adverse effects of continuing the therapy, meaning bleeding, during surgical procedures against the adverse effects of stopping, even temporarily, the therapy, meaning they could be subject to a clot. So, four different conundrums that cross our paths every time we try to treat a patient with cardiovascular disease. Now, of course, you know we've got a solution for each one, yes? The first one is we always make sure we treat patients, okay? That's what we do. And we're always cognizant of the potential complication. Number two, we recognize that patients are likely to be stressed in a dental appointment, so we make sure that we always treat that stress, right? Always reduce the stress potentially, even if we have to use something like a benzodiazepine to reduce perioperative or preoperative anxiety. What else? Well, the use of epinephrine is risky, certainly, but we tend to believe that the benefits of using epinephrine by causing profound anesthesia and reducing the adverse effects of the anesthetic, we believe those benefits outweigh the risk of potentially tachycardia. A lot of that depends on the technique used and the accuracy of your injection. And finally, in the fourth case, we recognize that stopping anti-thromboembolic therapy is risky. It puts the patient at what many people believe is unnecessary risk for a thrombotic event. So perhaps it's best to have the patient continue to take their anticoagulant or antiplatelet agent, but it is important to recognize that it is based on the procedure itself and of course, maybe even getting medical clearance or a consult to really figure out if it's worth stopping the anticoagulant or an antiplatelet agent or continuing it based on that individual patient's condition and the procedure at hand. Hopefully this helps you out, my friends. I'm looking forward to our next edition. Again, all about cardiovascular disease. Stay tuned. Thank you so much. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.